And on that note, I'm going to do an introduction, and everyone who's still kind of hopping on the program can continue hopping on. So welcome everybody to this special evening. I'm really excited to bring you this workshop tonight, IEPs, 504s, and school evaluations. This is a workshop for families and caregivers, and certainly it could benefit any teens that would like to join us as well. We have two excellent presenters that are going to introduce themselves when they present tonight, but I do want to welcome Dr. Katrina Hermitat and Marissa Smolinski. They will tell you a little bit more about themselves, but I can tell you on behalf of the Tourette Association of America that Dr. Hermitat is a member of our medical advisory board, and Marissa Smolinski is a member of our education advisory board here at the Tourette Association. We are bringing this program to you tonight free of charge because we are at the Tourette Association of America. We work in cooperation with the CDC, the Centers for Disease Control and Prevention. And with that in mind, I will be putting in the chat resources for you to access during the webinar. I will also be putting a way for you to reach out to us to get these resources if you can't access them during the webinar, or to get hard copies of the resources and any other needs that you may have. I'll be providing ways for you to reach out after the webinar. The chat is disabled to people that are on as attendees. You'll only be able to access what I put in there. However, throughout the webinar, please put questions in the Q&A. That is where I will read questions at the end to Dr. Hermitat and to Marissa. And I will also be able to answer some of your questions in the chat while they're presenting, because we want to make sure that we get to everything. So on that note, Dr. Hermitat, you can share your slides and we will begin.
All right, thank you so much. So hopefully, with COVID, we're really good at sharing right now. So just give me a second. I'm hoping we can be fast. Okay, so does everybody see the slides, Wendy?
Looks great, Katrina.
Okay, great. And so I can't see you. So like I said, like Wendy said, if you have anything that you want to ask, any comments about your own experiences with 504s, IEP, and school evaluations, feel free to put them in there and Marissa and I can take a stab at them. So like Wendy said, my name is Dr. Katrina Hermitat. I play many hats at my institution at Akron Children's Hospital. I am the Division Chief of Neurobehavioral Health and Psychology. I'm the Clinical Director of the School Success Clinic and the Tic and Tourette Service. And so today is a perfect presentation because I get to talk about both of my passions and both of my love, which is when special education meets the needs of kids that have Tic and Tourette syndrome. I did my graduate education at Lehigh University. Lehigh University is considered the birthplace of response to intervention, which we'll spend a little time talking about. I did my graduate training in pediatric school psychology, and my postdoc here at Akron Children's Hospital. Prior to joining the faculty at Akron Children's Hospital, I actually was a school psychologist at Upper Darby School District, which is just outside Philadelphia, and at South Brunswick High School, which is just outside Princeton, New Jersey. So before we get started, I figured I could talk a little bit about my professional identity. So there's actually a subfield within school psychology called pediatric psychology, and Power, DuPaul, Shapiro, and Parrish really were the leaders of this subfield. And the whole purpose of this subfield is to try to meet the needs of kids that are stuck between the siloed systems of healthcare and public education. And so for those of you that are attending this presentation, I bet some of your kids are here, right? We have a medical diagnosis and we're trying to figure out, where does that fit in the public school system, or where does that even fit in the private school system? Unfortunately, kids with complex medical needs sometimes get stuck between the silos. And that really is the purpose of pediatric school psychology, to make sure those two systems are talking to each other. So even in this field, right, I've spent my entire doctoral training, my dissertation on special education. It is incredibly complex. And so I really appreciate that you guys are here being advocates for your children and yourselves. The clinic that I work at Akron Children's Hospital is called the School Success Clinic. And I wanted to spend a second talking about this because this could actually be a resource in your local healthcare systems that you might not even know about. So, in some large healthcare systems, like Akron Children's Hospital, or like Nationwide in Columbus, or like Wisconsin Dell Children's Hospital, there are actual clinics that have educators as part of those clinics to help these kids that have complex medical needs. And so this is what our team looks like. So as you can see with this team, it's very reflective of what an MFE or an ETR team might look like in the public school system. So we have OT, we have speech pathology, we have somebody playing the medical role, and then we have a navigator that helps with these evaluations, getting them to the public school system. And the reason why we have this model is that when kids are hurting, kids go to the doctor. And so I recommend to you guys that if you're feeling frustrated, if you're stuck between those silos, in addition to your public school system, make sure you're sharing that with your primary care provider, because your primary care provider might be able to help give you guidance and support, and might be sitting on a lot of resources about your child's complex medical needs and the way that impacts their academic functioning. So I think of this quote, Akron sits, it's one of the closest urban centers to Appalachia. We had a family come in through School Success Clinic. I said, wow, how did you find us here? And the parent said, well, my son is hurting. And when my son is hurting, I go to the doctor. And so that can be physically hurting, that can be mentally hurting, or that can be academically hurting. So don't forget your medical team when you're trying to navigate this system. This is really the creed that I live by, and this is what I want to share with you before we start talking about ETRs. This is one of my favorite quotes from a 6-year-old, that my teacher thought I was smarter than I was, so I was, right? And that is the idea of building capacity and building resilience. As you know, being parents of kids with tics, these are brilliant, smart, intelligent kids that sometimes get stuck in that discrepancy model, that beautiful brain that we know that they have doesn't get to show off academically in the way we know it can. And so that's what I want to focus on, is how do we make that evaluation process really capture what our kids are capable of. So just a little bit of data. So the number of children between age 3 and 21 served by federally supported special education programs is about 13% of total public school enrollment. That is massive. And so when we look at the breakdown of this, the majority of kids that fall under this fall under what's called specific learning disability, which we're going to talk about a lot tonight. But a lot of you on this call, your children might be serviced under what's called other health impairment. And so we're going to talk a little bit about that too. So the objectives for tonight, for this portion of the presentation, is I want you guys to become familiar with that school-based eligibility. So how do I go from identifying a need and requesting that evaluation to having a fully developed, individualized IEP or 504 in front of me? That's what we want to help you with tonight. I also want to go over just some current updates and changes in national education initiatives, and really focus on the way that this particularly affects tic disorder and Tourette syndrome. So we're going to fly through this pretty quickly. This could be an entire dissertation, an entire presentation on its end. What is special education? So I want to talk about the brief legal history of special education. When you talk to special educators, whether that is special education teachers or school psychologists, when we talk about those seminal laws, those foundational laws that established what we know now, we always go back to 1954's Brown versus Board of Education. That might be familiar to you. That is when it was concluded that segregation on the basis of race violated equal educational opportunity. So those last 3 words, equal educational opportunity, still ring true for what Marissa and I do every single day. We're always coming back to that. Is there equality for our kiddos as they fall across the spectrum of need? And is that opportunity equal? So in addition to that, in 1973, there was the Rehabilitation Act. That guaranteed civil rights to disabled people and required accommodations for disabled students in schools. This also might sound familiar to you, because this is the foundation of Section 504. So the full name of Section 504 is the Section 504 Rehabilitation Act of 1973. That's actually the full legal term. And so for those kiddos that are on the call tonight, the parents that have accommodations under that goes all the way back to civil rights law. Probably something that you guys are very familiar with is IDEA. So that's the Individuals with Disabilities Education Act in 1997. Really, when you look at the core components of an IEP that Marissa is going to talk about, it traces back to that 1997 law. Many of you as parents remember this maybe even when you were kids with No Child Left Behind. No Child Left Behind was in 2001 and 2004 as part of George Bush's legacy. That was to require teacher accountability and school accountability, in addition to infusing special education with technology. When we look at recent statute, many of you on the call might be familiar to this term. It's called response to intervention. That's the idea of capturing kids before they fail. So this is in response to a wait to fail model, meaning that we give kids increasing intervention to find out where their frustrational level is. And oftentimes we organize these kids in a tiered model of support so that kids don't have to fail before they begin the ETR or MFE process. Finally, the last two I want to talk about is Common Core. Again, this might be something very familiar to you. In Ohio, this really focused on academic standards. So we had something in Ohio called the third grade reading guarantee, that if kids did not pass a reading exam in third grade, they would actually be held behind. In 2016, Equity and IDEA occurred. So this is more recent statute. This was making sure that we captured minority students before they failed. We made sure that special education was equitable and equal, and that we looked at disciplinary and restrictive processes in the classroom for these students. So that's a lot, right? We just went over almost 100 years of special education law in about 4 minutes. And so if I could boil it down, apples to apples, this is what it is. It's free, appropriate public education. So each one of those words is powerful in the least restrictive environment. And so when I see kids in school success clinic, I'm coming back down to what's called FAPE and LRE. So for our kiddos and parents on this call, you have a child that has Tourette syndrome, that child has coprolalia, the education team decides, hey, this is really offensive to the rest of the class. We're going to put your child in a one-on-one environment with a teacher, and we can really give that kid individualized supports. What I would say is that is a restrictive environment. So that violates the child or student's rights with putting them in a more restrictive environment than that they need. We always are looking at least restrictive environment. So now let's talk about the how. So the how is, how do students go from identifying a need all the way through an evaluation? And this really differs by state. So I'm going to say a caveat that a lot of what I'm talking about tonight, I'm going to apply to Ohio standards. However, I can speak to both Pennsylvania and New Jersey, also living there. And Marissa's really going to help me really make sure that I'm giving a national scope. So in some school districts, the process is called a multi-factored evaluation. In some schools and states, it's called an evaluation team report or an evaluation and testing report. And so the way that I was trained is that the MFE is the process and the ETR is the product. So first, let's talk about this process. So the very, very first thing is when you have concerns about your child's academic functioning or their behavioral functioning impacting their academic success, I always recommend to put that request in writing and put that date on there. So for example, tonight's October 18th. If I had concerns about my daughter Eva's tics impacting her success, I would write a note that says something like, Dear school psychologist or special education team, I have a concern about my child's ADHD and tics impacting their educational functioning, and I would like to have them evaluated. The most important thing, I cannot stress this enough, is that there's a date on there and there's a signature on there. So even if you run into the superintendent at the grocery store, even if you have a really good conversation with the teacher during conferences, in the eyes of the law, those conversations really don't count because we want a dated signed request. Okay. The language that I have in here is really elegant. You could say something like, I have concerns about my kid's success. I would like to meet and start the evaluation process. It doesn't have to be this formal. The most important thing is that date and that signature. Okay. The next step, after the school receives this request, and Marissa's going to help me with this, there's a timeline. So in Ohio, the timeline is that the school has 30 days to respond to that written request. And in those 30 days, the school says, yes, we agree that there is likely a concern. We're going to go forward with the ETR process. Or the school can say, No, we do not have a concern. And these are the reasons why. Okay. I always recommend to my patient families that if the school says no, I request that that no is put in writing. And that is called a prior written notice, at least in the eyes of Ohio law. A prior written notice says, we're not evaluating because this kid is going through the RTI process, or we're not evaluating because they missed so much school from chronic absenteeism that we want to have a really good baseline of attendance before we begin the evaluation. If they say no, they have to legally tell you why. So, say the school agrees, say that there are some concerns that are showing up. Then, what they're going to do is this multi-factored evaluation, or this ETR. It's multi-factored because there are so many pieces that go into an ETR. These are just some of them, right? There might be behavioral observations in the classroom in both structured and unstructured environments. They're going to be doing an IQ test. They're going to be doing achievement testing. If they're an RTI type district, they might be doing CBM, or curriculum based measures. There might be speech, OT therapy screening, sometimes even PT therapy screening, permanent product review, interviews with teachers, interviews with parents, and often an interview with the child. So when you look at that, that's a lot of work. And so when I say to families, is in Ohio, it's 60 days. So from that evaluation of saying, yes, we're going to go ahead, the school has 60 days to do all of that. And so it's a really long wait. So I will have families actually calculate what is 90 days from the day of the request, because that's the timeline that the school has, right? It can feel very long. And if the school goes over, they're actually out of compliance. So they really have to stick to that date of the written request that you provided. So again, this is the same thing. So this is per Ohio Department of Ed, or IDEA. The school has 30 days to respond. If they say no, they have to write a prior written notice, and they have 60 extra days to do testing. So it's a 90-day timeline, or a 120-day timeline. So this is, again, a little bit of a visual about the ETR process. For any of your states, you can pull this visual. So if you put, the Wyoming ETR process, it'll show you all the steps that are specific to your state. So now let's actually look at what an ETR and an IEP can look like. So we do all of this data. We do this giant multi-factored evaluation. After we do this multi-factored evaluation, we have to talk about the identified areas of need. And so this is what a typical ETR might look like at the end. We might say, yes, this child meets criteria, maybe for a learning disability, and here's the academic areas of need that the IEP is going to address. And that's what Marissa is going to talk about in a few minutes. When a district does this, the district also has to check these check boxes. Are the learning concerns that we see a product of some of these other other situations? Is it a product of cultural factors, right? So is this a family that recently moved to from Nepal? Is this related to economic disadvantage? Does this child have access to the technology or the needs that they require to do homework, right? Is it related to English proficiency or emotional disturbance? And if the school checks one of those, we might kind of go back to see if developing an IEP for this child really is the most appropriate tool. So then after completing the MFE or the ETR, the school district has to say, is this child eligible or not? So they're going to look at all of that data and make that determination. This is incredibly important for your kiddos. Just because a child has a medical diagnosis, that doesn't mean that they automatically qualify for services. And this often happens for families that get a diagnosis of ADHD. They wait forever. They finally see that specialty team or that primary care doc to give this diagnosis, and they think that the diagnosis itself is a ticket to ride. The school still has to demonstrate that that medical diagnosis is getting in the way of that child being academically successful, right? It gets very, very hard sometimes for kids with tics, especially because you guys know they're brilliant, right? And so sometimes I will really push hard on the districts, because are these scores that look very average in the classroom, is that truly representative of their actual academic and cognitive capacity? So again, that is the question that the school has to ask. And sometimes as a parent, you might have to provide evidence. So for example, I've had patients with tics in school success clinic that I say, okay, they're failing academically in the classroom, but when we put them in a one-on-one testing environment, look at these incredible scores. So the discrepancy between a one-on-one testing environment and a traditional learning classroom environment, this split would be evidence that that child's diagnosis is getting in the way of them being academically successful. I always say to be mindful of what's called the RTI process. So RTI again stands for response to intervention. That's the concept that we take the entire district, we do universal screening, we put all of those kiddos in a beautiful pyramid where the bottom of the pyramid is general education, and then we go up the risk level, right? So we have to make sure that our district, if they're doing RTI, our kids are not languishing in that second tier, right? The idea of RTI was to catch kids before they fail, not let kids sit in tier 2 forever. So as I kind of wind down my section of the presentation, it's important to remember what I call the big 13. Okay. The big 13 are the eligibility categories under IDEA. So these are the categories that your child can receive services after doing that evaluation of that ETR. Okay. I want to show you two, right? We're going to talk about other health impairment and specific learning disability. But there are some diagnoses that aren't on there. And I would argue should be. So I think about diagnoses like anxiety and depression. Those are actually not part of the big 13 under IDEA, which means you cannot get an IEP under anxiety or depression. What if your kid had significant trauma, right? Because we know trauma affects learning in the classroom. There is no IDEA category for PTSD. Another one that I bring up, a lot of our kiddos might see physicians that give diagnoses like executive functioning disorder or auditory processing disorder. While those diagnoses give us a lot of information about that kid's academic functioning, those are not part of the big 13 eligibility criteria. And so sometimes what I will say in my practice is this child meets minimum criteria for ADHD. Their ADHD symptoms impact their executive functioning. So that's me playing by the rules of the big 13, giving a qualifying medical diagnosis under other health impairment so they can receive services for their executive functioning needs. So other health impairment, what does this mean? Other health impairment means having limited strength, vitality, or alertness, including heightened alertness to environmental stimuli that results in limited alertness with respect to educational environment. And so it lists out specific medical diagnoses that fit as a qualifying condition. And so you can see in here, a lot of our kiddos might have ADD or ADHD, as well as Tourette syndrome. So I always laugh with my Tic kiddos and say, like, we had a good lobbyist when this was being written because Tourette syndrome is included right in there. And so I'll often highlight that if I'm helping a parent write a written request. My child has been diagnosed with Tourette syndrome. According to IDEA, Tourette syndrome is a qualifying medical condition under other health impairment. I would like my child evaluated because I feel like their Tourette syndrome sequela is impacting their academic functioning. That would be a beautiful written request. Again, in red, we have to demonstrate that those OHI diagnoses are actually impacting educational success. So I'm going to go through these really fast because I want to make sure Marissa has plenty of time to talk to you guys and that I have plenty of time to answer your questions. When we say SLD, right, that means a specific learning disorder or a specific learning disability. That also has to have with an impairment in. So that could be with impairment in reading, with impairment in written expression, with impairment in math. Now in the DSM, there is no learning disorder not otherwise specified. You have to say what qualifier is associated with SLD, and you often have to say severity. And so you might see after completing an evaluation, your child meets eligible criteria for specific learning disability with impairment in written expression, specifier moderate. So that means their SLD moderately impacts their written expression. When we look at the definition of this specific learning disability, the piece that I want to show you is dyslexia is in there. That's really, really important. And that's actually a change to the law. So for a very long time, dyslexia was not included in the national definition of SLD. So for your kiddos that have dyslexia, sometimes what we might have to do is give really rich reading support in the classroom and get multisensory support outside of the classroom, right? So again, dyslexia is kind of a unique diagnosis with a very specific interventional pathway. And so if your child has dyslexia, I would want to know at your school district what kind of intervention and support they might be providing for that diagnosis. So, back in the day, the way that you would define a specific learning disability was that your IQ could not predict how you're going to do in reading, writing, and math. So, the average IQ is between 85 and 115. So, let's say your kid is a super bright kid with tics. Their IQ is 110, right? So, that's their IQ. We would predict that their reading, their writing, and their math should cluster around their IQ. If it does not cluster and there's a significant discrepancy, that's how we define using this discrepancy model of a learning disability. Okay. There's a lot of issues with that because when I look at districts around here, I look at Hudson, which is a very high achieving district. Maybe to qualify for specific learning disability in Hudson, they only need an academic score of maybe an 83. So that's 2 points below. Then, if I look at a more struggling school district like Canton, just down the road, right, maybe to qualify for special ed in their district, they need achievement scores of a 72. And so what you end up having happen is that kids on one side of the street, this happens, and on one side of the street, this happens. And that really was the purpose of RTI, is to start universal screening and catch kids and make something that was more standardized so we didn't have issues of social justice and inequity with school districts. So what is a learning disability not? A learning disability not is a child that like was doing well in school and then recently their grades dumped out. A learning disability is not a child that has significant internalizing difficulties like anxiety whose performance is being affected. An LD is not a non-English speaker. So that really concerns me. I think sometimes when districts have limited resources, they might put our non-English speakers in with kids that have specific learning disabilities to support their skill set. That would violate least restrictive environment. A learning disability is not a child who has ADHD, who has academic skills, but whose symptoms of ADHD make it difficult to stay focused. So that is not a learning disability. That is the academic profile that we know goes with ADHD and sustained attention in the classroom. So what happens next? I'm going to punt it over to Marissa to talk about the IEP and 504 process. And we both share this next slide. So I'm going to give it to her to just really talk about the differences between an IEP and a Section 504. So after we do this evaluation, where do we go from here?
So what I'm going to do is I'm going to quickly share my screen. Thank you so much for your patience while we switch this up. All right. So quickly, a little bit about me. So I'm Marissa Smolinski. I have an undergraduate degree in interdisciplinary studies, Jewish education from the University of Maryland, Baltimore County. And that was actually a focus on Jewish special education. A master's in education and special ed from Northern Arizona University. I'm currently an elementary special education department chair in Northern Virginia, as well as the inclusion coordinator at a synagogue. I'm a TAA education volunteer and part of the TAA Education Advisory Board. Before that, even I was an inclusion teacher in Virginia. I was a self-contained teacher in a program for students who have severe emotional disabilities and behavior disorders, as well as in Arizona, I was a middle school special education teacher. And personally, I have Tourette's. I have had students in my class with Tourette Syndrome and Tic Disorders, and my daughter also has a Tourette diagnosis. So this is very personal and professional to me on many levels. And so I'm going to skip around. I apologize because I want to make sure that I pick up where we left off. So after you have gone through that process, when you've evaluated all your testing, if a child is eligible for special education, you will then have, at least in Virginia, we then have 30 calendar days to write an IEP, which is an individualized education plan. And that is covered under the special education law, IDEA, and is funded by the Department of Education. And that is, you have met the criteria for one of those 13 areas of eligibility. And it has a significant impact on your educational performance. And the biggest piece of the IEP is that you require accommodations and modifications, especially specially designed instruction. And this is just for education law and just for education. So an IEP can start as early as preschool and goes through 12th grade, or when a child is exited from a public education after their 21st birthday. If your child does not meet the criteria for an IEP and receiving special education services, then you might look at a Section 504 plan, and that is covered under the Rehabilitation Act.
Hey, Marissa, I'm sorry to interrupt. I just wanted to say your slides aren't changing. I don't know if you meant to change them from your original.
I'm still, my slides didn't change. It says I have that the IEP 504 slide is up.
Yeah, we're seeing your biography now.
Ooh.
So,
Okay.
so I just wanted to
I'm going to stop my share. I apologize. Thank you for interrupting. I don't know what's going on. So I'm going to try sharing again. Thank you everyone for your patience. All right. Now, can you see the next slide?
It's over on the sidebar. But we can't see it full screen.
Interesting, because I'm full screen. It says my screen sharing is paused. I don't know why my screen sharing is paused.
Let me make you a co-host and see if that'll help.
I apologize, everyone. Thank you for your patience.
Here you go. Let's see if that helps.
All right. Technology never works when we want it to. All right. How are we doing now? It still says, but your screen sharing is paused.
I don't know why, but you know what I could do is pull your slide. Or I'm sorry, I could pull the slides up and share them myself. I muted myself. Just 1 second.
That's okay. I am so sorry. Thank you, Wendy. I appreciate your help with this.
You are welcome. I'm going to put it on the one you were talking about, and then I'll try to get it full screen, but at least we're here. No problem.
Good. I'm so sorry, everyone. Thank you for your
all the great information. Like, it just really made sense to what Katrina already said. So just keep going where you left off. It's all good.
All right. So when we're looking at that 504 plan, you're really just looking at, does a child need accommodations? There is also no age limit with the plan. So kids who have an IEP in elementary school and middle school and high school, when they graduate, they can transfer over to a 504 plan to continue to have supports in college. So their discipline may also be a little different. One of the things we look at, especially with an IEP, was the discipline because of a manifestation of their disability. A child with an IEP can only be suspended for 10 days the entire school year. If you reach that 10th day, then you immediately have to go to what's called a manifestation determination meeting to determine if the behaviors and the reason for the extended suspensions are because of the disability. If it is because of the disability, the child cannot be suspended for the rest of the year, but the team might require that you look at possibly an FBA, a functional behavior assessment and behavior intervention plan, or maybe an updated reevaluation to determine the best needs of the student at that time. So Wendy, can you go to one slide ahead quickly? Slide 2, actually. So this is slide 4. Can you go to slide 2? Thanks. I appreciate it. So something to think about, because just like Trina said, students with Tourette's and Tic disorders, it really can go either way depending on what their needs are. Just because you have that medical diagnosis does not mean you automatically qualify for that IEP. And so this is a flow chart one of my colleagues on the Education Advisory Board created to sort of talk about what's going on at school and what options you have. And so if a child is struggling in school, then you can go down to, are there challenges that are a barrier, or is the challenge acceptance? If it's acceptance, then I would advise reaching out to the TAA, and we can help with our different presentations on how to support students and better understand students with Tourette in the classroom. If the challenge is a learning barrier, then you're going to want to look to go through that eligibility process and determine whether a child really needs that 504 plan, because with accommodations, they will be successful, or whether they really need that specially designed instruction that is offered through the IEP. So now can you go to slide 5, please? All right, and I'm going to quickly, I talked through a lot of this already. I'm going to quickly go through because I do want to make sure we have plenty of time for questions. So a lot of this was covered. Section 504 is federal civil rights law. It's through the 1973 Rehabilitation Act, and it protects qualified students from discrimination based on disability. One big piece that is different also with the two is consent with a 504. With a 504, parental consent is only required for that initial evaluation, but it's not required for initial placement. Parents are and this says IEP, I apologize for that typo. It has been a long week for me. Parents are not required to attend or consent to the 504 plan. It is reviewed annually, but again, parents are not required to attend and are not required to consent. Best practice would be that parents consent and are a participant, and students as they get older become participants. Back a long 20 years ago and more now, when I was in high school, I know I did have a 504. I only actually found out about it as an adult. And so I definitely was not involved in my process. And I'm not sure how much my parents were totally involved on the yearly and day-to-day basis. So something to think about also is making sure that you are that advocate and your child is that advocate, so that you are part of that conversation, because you should be invited, but unfortunately you are not required to be there. Next slide, please. So a 504 plan really focuses on accommodations that students need in order to be successful in the classroom. So some common accommodations that we have for students with Tourette's and Tic Disorders are frequent breaks. Maybe they'll have a wiggle seat or a kick band on their chair, different fidgets. For older students, I've seen a lot be successful with chewing gum. And for younger students, a Chewy, as well as Trina mentioned, small group testing. If we know that a child is going to perform to their potential in that smaller group or one-on-one environment, we're going to want to make sure that for all testing, they have that option as well. And an additional one that is not listed is also extended time, so that they have time to not have to stress about their tics, and that won't interfere with any timed assessment, including SATs and AP exams. Next slide, please. So then the next piece is that IEP, that individualized education plan, and this is covered under federal special education law, IDEA, and it provides that specialized instruction. Parents need to sign consent for every piece of the IEP process. So all of those eligibility pieces, as well as at least once a year, the IEP team needs to meet to create new goals, as well as review all the additional modifications that a child might need, accommodations, service hours, and least restrictive environment. No changes can be made to any plan without parental consent. Parents also then have the right to partially consent. They agree with the goals, but they don't agree with the service hours or the environment. So parental consent is extremely important in the IEP, and it is a pivotal part of being able to provide those services and receive those services. Next slide, please. So the IEP has a lot more components. You're going to look at the specially designed instruction that a student will receive. So are they getting that direct social skills instruction? So maybe they're getting specific lessons on how to take turns in a smaller group environment and then support transferring that. Are they getting direct instruction using coping skills? What do we do when we're frustrated? Do we have a squishy ball that we like to squeeze? How do we take deep breaths? All of those things would be specially designed instruction that a child would need in order to then be able to access the curriculum in their academics. A goal, which is a modification, are there to support. We're not going to write goals about tics because we're not trying to change our tics or get rid of tics or modify our tics, but we are trying to make sure that we can access the curriculum. So I gave an example. I know, especially when I had to do non-preferred activities, I was slower to start, and part of that was because things that I don't like to do stress me out, and that makes my tics worse. So I might have a goal, like when given a non-preferred task, Marissa will begin her task within 2 minutes with no more than 2 reminders on 4 out of 5 opportunities documented weekly. So here I'm stating exactly what it stated exactly what I need to do. I need to start my task in 2 minutes. If I start my task in 2 minutes and adults only need to remind me 0, 1, or 2 times, then I've met the basic criteria. I want to do it consistently enough that I'm doing it 4 out of 5 times a week, assuming that I have at least one non-preferred activity a day. Should be easy to get data and support for those 4 out of 5 opportunities. You're also going to have accommodations in an IEP, just like you would in a 504 plan. Then you're going to talk about that least restrictive environment, which Katrina mentioned as well. Where does the child need to be to access the instruction? Some things, like some of that specially designed instruction, a lot of times is better to access in that smaller group setting. If you're going to do a social skills curriculum that is specially designed for students who might have some executive functioning skills or some social skills deficits, doing that in that smaller group setting so that they can really gain that access with minimal distractions is probably preferable. That doesn't need to be more than around 2.5 hours a week. 30 minutes a day is usually a great amount of time for that instruction. And then you would also want to look at supports in the gen ed setting, because we want to generalize it. The goal is not to spend all day in that small group setting. It's to be with our general education peers and accessing that instruction with the supports we need. And that's where service hours comes in. An IEP gives access to special education staff. So what type of services does your child need, and where are they going to get them? Are they going to get them in a small group setting, that special education only setting? Or is the special education teacher or staff going to push into the general education setting to help them generalize the skills and to work with them? You also might have related services like speech services or OT or PT or adapted PE, depending on your child's needs. There's legally required progress monitoring. Every quarter, you have to send home progress reports on how the child is doing on those IEP goals. If a child is not making progress, we legally have to come back to the table to maybe write a different goal that is more appropriate and better. If a child has made progress, then we need to write a new goal. If has met the goal, we need to write a new goal. But it is forced communication, just like the report card is from the general education side. The IEP progress reports are that communication to you at least 4 times a year. Next slide, please. Wendy, that's your QR code. So I know I rushed through that information really fast. I wanted to make sure that we had as much time as possible for questions. So at this time, I think I will open the floor. I know Wendy wanted this QR code, and then I think it is time for questions.
Yeah,
thank
you,
guys.
Thank you, Marissa, so much. And Dr. Hermanton as well. Thank you so much. This QR code, if while we're answering questions, you could please use the QR code, and I'll put a link in the chat as well if you can't, access the QR code. Could you please fill out the evaluation for this particular webinar? We would greatly, greatly appreciate it. It helps our funding. It helps us secure our funding to have your feedback, and it helps inform our future programming. It will only take a few minutes, and if you don't mind doing it now while we're on, like I said, I don't think I emphasized enough the great appreciation for you filling out the survey. So on that note, questions and answers, I don't know if what's in there right now, but I'm going to find a few to read off, and I'll read them so that Dr. Hermitat and Marissa can answer. Here's one here. I think, what are some appropriate evaluations to determine executive function skill level and the social emotional development?
So for executive functioning, again, a lot of pediatric healthcare systems might have services called like executive functioning clinic, where they'd be able to do a full battery to look at your child's executive functioning profile. However, in a lot of school districts, executive functioning, while not one of the big 13, is really a hot conversation button. And so two screeners that I would maybe write down or keep in pocket, one is something called the brief. The brief is actually a screener. So there's a parent report screener, there's a teacher and a self-report screener, and it's really just asking questions about executive functioning. So remember, executive functioning lives in the frontal lobe. It's in charge of things like organization, working memory, emotional control, shift, a lot of the things that our kiddos struggle with every day that impact academic success. Some school districts, especially really savvy school psychologists, might have tools. One of those tools might be something called the DCAFs. So the DCAFs is an assessment of executive functioning that's really becoming a very common tool for school psychs to incorporate into that ETR, into that MFE. So again, the brief is a screener. The ETR is actually a testing tool that you can use. For social and emotional development, I really hear two things in there. So when I'm working with a kiddo, either as a school psychologist or at Akron Children's Hospital, the first thing I want to do is I want to do something called a broadband screener. And a broadband screener is a screener that looks at every single mental and behavioral health thing that could be out there so that I can really start kind of narrowing in on my diagnostic conceptualization. So a broadband would be something called the BASC, okay? This is probably, and I bet Marissa knows this is probably the most common behavioral and emotional screener that schools use. This is going to be looking at things like anxiety, ADHD, depression, even risk-taking behaviors, adaptive function.
Just to jump in, it is very different from the Vanderbilt, which a lot of the medical doctors use.
Yes. The Vanderbilt and the ABAS, that's adaptive functioning. So that would go to that second part of what you asked with development. So those are two developmental measures, ABAS and Vineland. You're totally right, Marissa. Medical systems love a Vineland. Schools usually love an ABAS.
Vanderbilt, I confuse them all the time too. Vineland is those adaptive, because schools will do Vineland when we're looking at those adaptive skills, especially under intellectual disabilities. But every doctor I know, when we submit, my kids included, Vanderbilt's all the time, but schools were Basque and Connors.
Yep, that's exactly right. Yep. And that's the next part, right? So after we do this broadband and this developmental, then we're going to really start narrowing in on what our diagnosis is. So we might use tools like the Connors that's looking very specifically at ADHD. We might use something like the Beck, which would look at depression and anxiety, right? So those are the types of tools that your school psychologist will be using. Okay.
Okay, great. Thank you for that. Next question is there any age limitation to be added to 504? And I think this is coming from Korea, that there is an age limit, but I'll let you answer that in the US and in elementary school, preschool.
So it looks like it's from Korea. So, part of a lot of what we're talking about is run by education and disability law in the United States. And so because it is based, and I think Katrina, you might be frozen. I don't see you moving. It is, and so therefore I don't have any personal information, or professional information on Korea and what their education and disability laws look like. I'm really sorry about that.
I think that we can just tell in the US that 504
Yeah.
plan can be given to age preschool all the way through high school.
Yeah, that's IDA. That's an IEP. 504 is actually is essentially can be given for life, and you can have a 504 in college, and it would then be however your workplace handles ADA accommodations is this equivalent of a 504 as an adult.
Thank you. Thank you.
You're welcome. Sorry about that.
No, that's good. I wanted to answer in the context of school, but you're absolutely right as well. Let's see. My son and Katrina's power went off, so it looks like it's just you for a little bit, Marissa.
Sounds good. I will try my best.
For Katrina here. So my son goes to a Catholic school. They use his psych ed eval to create an ILP, individual learning plan. It sounds a lot like an IEP, but I imagine that it doesn't have the same implications of enforcing as an IEP. Any recommendations in navigating all this in the private school setting? Can they get a 504 or IEP if necessary? At what point do we say the ILP is not enough? Thanks. Oh, Katrina's back.
So
Thanks, Katrina. Sorry, Marissa, I'll just tell Katrina. Marissa's going to start answering, but we're answering the question from Lori Soto. So if you see it in the Q&A there, I may have to make you a co-host again to do that if you came back on. Okay.
So I can actually answer this on a very personal level. My daughter is at a Jewish day school and also has an ILP to support her needs. So I'm navigating that piece actually as a parent as well. They, from at least the ILP that I have and that I've seen from other families that have come through my school in the public school world, they're more aligned with a 504. They are listing really the accommodations that my daughter will receive, and maybe a little more beefed up a 504 if in terms of she has access to the school counselor type of thing. But there's not really a good way to enforce in the private school world, unfortunately. They are not bound by these federal education laws. So it is really working with your school to see how helpful it is that your child be successful with these things. I can personally tell you, I got an email last year from my daughter's school. I knew they weren't following it with her sticker chart. And when they emailed me about a behavior, my response was, well, are you using her sticker chart? They really didn't have much to come back with me. So you knowing the ILP and then referencing it when things come up will be helpful to know that you are monitoring it and you are trying to work with them within the confines. You can always go to the public school system and request an evaluation. Different districts work differently. My school district, I am required to at least have a meeting for anyone who lives within my boundaries or goes to school within my boundaries. If we go through the process and do find them eligible for special education services, if they live within my boundaries, I am then required to write an IEP. The IEP would not essentially be enforceable unless they were in the public school system, but I have had parents who then take that IEP to their private school and say, this is what the public school is offering my child. Can you do something similar? If you're evaluated by the district, if I evaluate someone and we determine they are eligible because they go to school next to mine, but don't live in my district, and this is really common for my school because we have a very big prep school down the block. So we then go through the eligibility, but we are not responsible for that IEP. But the biggest thing would be seeing if they're willing to talk to any private therapists or doctors that your child may have, and signing those consents. Sometimes private schools might be more willing to listen to them than a parent. Unfortunately, I have found that, but you can always then reach out to your public school. It is up to you to determine when you feel it's appropriate to continue the services at the Catholic school or not. It really would be an individual decision based on your beliefs and the type of education that you want for your child, and the types of services that the public school is able to offer versus the Catholic school. I hope that answered your question.
Okay, great. Thank you, Marissa, for that. The next, I am going to say, somebody asked, could you spell out the evaluation acronyms? And you know what we'll do? We'll follow up with those, spelling out all those acronyms in an email, if that makes sense to everybody. We have everybody's contact that registered for the webinar, so we will be doing a follow-up. And here's the next question. Is a school social worker the same as a school psychologist?
So the answer to that is no. So a school psychologist is really leading that evaluation process, right? So they often have a master's degree in an educational specialty, and they're really leading the process of collecting all of that information to make that ETR, right? A school social worker really has many hats in the public school system. So a school social worker might be working on mental health intervention, might be doing universal screening for behavioral and mental health needs, might be also aligning outpatient social services or like services outside in the community for families that are at need. So they play really a key role in a child's interpersonal success, but it is the school psychologist that's actually doing that evaluation process. It's amazing. You probably went maybe your whole educational career and did not meet your district's school psychologist team. That's often because one school psychologist might be assigned to 3, 4, 5 buildings in the district, and their entire job is doing ETR and MFE processes. So they're probably working in multiple buildings, pulling those kids that are in tier 2 or at risk and doing that evaluation process. So while a lot of us that went to school for school psychology want to be doing more, I would say, mental health intervention and support, a lot of times in a traditional public school system, they're mostly doing ETR and leading the MFE process.
Great. Thank you so much. I'm just reading through all these questions, and I know that we are at time. I don't know if Katrina, you or Marissa would be willing to stay on for an extra 5 or 10 minutes. And so I'll let the attendees know that if you'd like to stay on, we're going to answer some more questions. I think it's valuable information for everybody if you're able to stay on. And those that we don't get to, we will follow up in an email. For those that need to jump off, thank you so much for attending. Thank you for doing the evaluation. I'll put the link in an email as well. And we'll just continue on. So we have an 11-year-old that is newly diagnosed with Tourette and just moved to middle school. So they have not, the family has not met with the IEP team to make any updates. And it sounds like they're new to the diagnosis, and they're curious as to the coexisting symptoms that might be important to address in the IEP.
For the questioner, could you elaborate on some of those coexisting symptoms?
Let's see, Allison, if you could elaborate in the question and answer section on the symptoms that are there. I think it makes a difference, of what they are to help answer the question for sure. And maybe in the meantime, I'm wondering if you have any thoughts about, like what coexisting conditions might be important to address in the IEP.
Oh, absolutely.
Sorry, I would say ADHD is usually the most common one, and I would say that I would recommend the goals be written to support the ADHD, because that's really something that you can support and work through and reach, because while ADHD does have a lack of control, there are lots of skills that you can gain to gain that control back. Whereas this is coming from someone who has an ADHD diagnosis as well. Whereas we know that there is a lot less control over the tics, and we would never want to make a goal for the tics because that's not something that's sustainable and achievable. whereas making a goal that would address a lot of the ADHD pieces would be sustainable and achievable.
Yes, and unfortunately, as we know, right, tic disorder clusters with anxiety and OCD and ADHD, but anxiety and OCD are those internalizing conditions that are not part of that big 13. And so even if that child's, really their school success is being driven by their anxiety and their OCD symptoms, a lot of times that IEP might not capture it. So exactly what Marissa said, we might be writing more traditional accommodations based on maybe their comorbid diagnosis of ADHD, which might also support anxiety and OCD in the classroom because we know those three diagnoses share a lot of symptoms.
Great, thank you so much. And I think also I just wanted to add, social skills, that there could be goals for social skills as well that could be related to all the things that you have all mentioned. So this one isn't really a question. I don't have a question here. Let's see. Oh, wait, maybe we are getting to the question in the next one. I just want to read it real quick. So I think could you talk about, I think I'm just going to, this is Heather's question or Heather's comments here. I think what would be important is to talk about how to be able to tell if tics are impacting a student's academics, right? And maybe even since we're talking about that, maybe impacting their social skills or social life at school as well.
Yeah, so the best tool that we have for this, and I actually wrote this, I was writing some answers and responses while Marissa was presenting as well, and I wrote about this in there. A great tool that schools have and they're sitting on is something called an FBA. So FBA is a functional behavior analysis. I am very, very careful when I talk about an FBA and using an FBA for kids with tics because I don't want the school to hear that the tics are functional. However, what I would love is that if the school uses an FBA tool, they can look at what are those environmental indicators or those setting events that are going to exacerbate tics in the classroom. What are some things that might be happening in the classroom that maintain our tic load? And what are the things in the classroom that allow that child to decrease or use their coping skills or use their competing responses, right? So it's still a very, very powerful tool that many school psychologists and behavioral interventionists are trained on, that's going to give us that really, really good live data. But really, as parents, make sure that if your school is using something like an FBA, they're realizing that the tics are not functional, but it's a great tool to get some observational data. That's where I would start.
And I would look, one of the things I would do is look at their grades. How are they performing on tests? How are they performing? Look at the different types of assessments. No school should only be doing those standard tests like we did or having to memorize. I know when I taught third grade, we had to teach 6 different ways to multiply, none of which were memorizing the multiplication table. So with that and looking at those, how is the child doing academically? If the child is struggling because so much is requiring oral responses and they have vocal tics, and so that's interfering, then that's impacting their education. If they are being disciplined because of their tics, that's impacting their education. So looking at those other factors, that data that you already have could also really be a good starting point, because while I agree that the FBA is a great tool, I can tell you schools hear FBA and they're immediately focused on finding that function and then possibly moving to a behavior intervention plan, which would try to teach replacement behaviors, which we know is not appropriate for tics.
That's great. And I also want to add those eye blinking tics and those hand tics can prevent kids from, reading well and writing. So those are all things to be aware of. The next question I actually am going to ask the person that asked about the Orton Gillingham and an advocate in New York to reach out to us directly here at the TAA. You have my email. First of all, you signed up for the webinar, so you can reach directly out to me, but I'm going to put the email support@tourette.org here so we can help you with that question. And then the next question, let's see. So I think that, this has been coming up a lot, this question, it's been coming up a lot for us here at the association as well, that a lot of children are being placed in, when we talk about the least restrictive environment, they're being taken out of the general education environment and being asked to go to different kinds of therapeutic environments, different kinds of schools and classes. And that's been really common. So I guess the question is, when that is happening, like when is it appropriate? When is when is it appropriate for a child to be moved to a setting outside of the general education setting?
So depending on what the child's needs are, there's no cut and dry answer to this because it really depends on the child. I would say for a child that needs some academic supports, if they need support in reading, then I would look at maybe 30 to 45 minutes a day of pullout to receive that structured research-based program like an OG program or a Wilson program, but getting that strong intervention in that smaller group setting, but then also having special education support in the gen ed setting to make sure that those skills are generalized and able to transfer out from that small group setting. I would say the same for math. Honestly, for social skills, it shouldn't be that much more because you want to get that direct targeted instruction in that smaller group setting so there's less distractions going on and you could really get that specialized instruction, but you always then want additional time to generalize it in the gen ed setting. A child's behaviors have to be really, really severe for behaviors to remove them. A child needs it. You need to be talking severe physical aggression where safety is compromised on a regular basis. And I'm not talking just verbal threats. I'm talking severe physical aggression. Students can be taught about Tourette's and coprolalia and disinhibition. And they can be taught about neurodiversity, and we can learn to accept everyone in our classrooms and work together and understand what truly is a threat and what is not, and what is from that disinhibition and coprolalia. However, if a child is throwing furniture, if a child is hitting, kicking, pulling hair, biting, then you might look for that smaller setting because that larger setting could be overwhelming. And remembering that behavior like that is communication, and the child is trying to tell us something in the best way that that child is able to tell us. And usually it's that they are overstimulated and need that smaller setting.
I also would say let the law be your friend, right? And this is why it's important that if we are able to demonstrate evidence that their diagnosis of TS is getting in the way of them being academically and behaviorally successful, that our IEP is qualified under OHI. The reason why is that if your child were to make a decision, or if the school was deciding to go a punitive route, the school has to do something called a manifestation meeting before they change significant educational environments or suspend and expel. And a manifestation meeting means, and I was actually writing this as a written answer to another parent, a manifestation meeting, I participate in probably one a week with the Tic and Tourette service. Usually it's the bigwigs of the district. They all sit down and they look at the behavior and decide if the behavior was a sequela of the medical diagnosis. So this comes up for TS all the time. So for example, if I have a patient that maybe says threatening statements, that's their vocal tic, we might have a meeting like this and say they have a vocal tic that sounds like a threat. Their reason for being expelled is directly associated with their medical diagnosis. It's a manifestation of Tourette syndrome. Therefore, we will not expel. We will not change learning environments. So that would be something else if you're taking notes, I keep in your pocket as a manifestation meeting. And also maybe even talk about manifestation meetings if your child ends up getting qualified under other health impairment.
Thank you for answering that. I think when I looked at the question again, I just want to make a point that both Katrina and Marissa made throughout the webinar, that there should not be goals for tics, whether it's coprolalia or any other tic. So if that is a problem, please reach out to us. I did put support at Tourette.org. You can reach out to me directly. We're happy to talk with you more and work with you on that and what would be appropriate in a 504 IEP, or I'm sorry, in an IEP as far as goals.
And
there are
to go, sorry to interrupt, just to go back to due process, every state has their own parental rights packet for special education, and a separate that's very thick. Like I know ours in Virginia is 44 pages. The 504 one is only front and back. But read those parental rights packets for your state and bring it up, bring it to meetings, bring it highlighted, throw it at the table. The team might not be happy, but it is your right and what you should be doing in order to support your child.
So there are so many more questions, and these questions do get saved on our Zoom. And I think some of these are, going to be quick for us to answer. And what we'll do is we'll copy paste them and answer them in the follow-up email to everybody. And we will get back to you with these answers, because I know that some of these situations, you just have these burning questions. And this might be an indication too that we do a part 2. I know we talked about this, Marissa and Katrina, and that might be an indication we need to do that. I so appreciate both of your time here. I appreciate all the time that you spend with the Tourette Association and all the work you've both done here already over the years, and this webinar tonight. If you have not filled out the survey, could you please go to the link in the chat and just click on it and fill out the survey for us? Again, very much appreciated, informs our programming. Thank you for being here. Have a wonderful night. Thank you again, Dr. Hermitet. Thank you, Marissa. Thank you for your extra time, and have a safe and wonderful evening, everybody. And we will be in touch with all of you. Please feel free to reach out anytime. Thank you. Bye-bye, everybody.
Bye.